we are still seeing infections surge, Dr. Renee. We're seeing, although the vaccine has rolled out, and we're seeing perhaps variants not take as hold of people when it comes to their health as before. Surely better to be safe than sorry. It's not unreasonable for the mayor to say, I will refuse you travel on public transport if you don't wear a mask. What's wrong with that?
I think what's wrong with it, Christo, is that there's very little compelling evidence that masks outside of a clinical setting do anything at all. And there are lots of reasons for that. And I have asked Sadiq Khan repeatedly to show me the evidence that he's basing his assertion on. And he hasn't replied, of course, but I wouldn't expect him to. But the evidence that I've seen now is that people don't use them properly. You've got people out there who are using masks for weeks on end. These are masks that should be used for 4 hours, the surgical masks. They're touching them, they're in their pocket, they're out of their pocket. I've got teachers as patients who say that they spend half of their lessons telling kids to put their masks back on. So not only are kids losing their education through not being there, through isolation, when they are there, they're focused on these grubby old masks that are on the floor, in their pocket, on their desk, off and on. We're really not using them properly, and then we're throwing away 52 million of them a day, which is wrecking the environment. So from that perspective alone, just usage, I think it's crazy, and that there's very little evidence that they do anything. What they do is signal fear, of course, to everybody that this is dangerous. But there are people in society who are really damaged by this. And by that, I mean people who have anxiety, and they're my patients. So I listen to them every day. They're really anxious about wearing a mask. It brings on panic attacks, but at the same time, they don't want to wear a lanyard that announces to the world that they have an illness. They don't want to just risk it because people can attack them verbally and actually make them feel very uncomfortable. I have patients that have PTSD. Some of them involve rape and hands over mouths, so they actually really can't have a mask over their mouths.
But respectfully, Dr. Renee, don't the exemptions cover those people who have those anxieties and that anxiousness?
Yes.
And the other issue being as well, and then I'll let you respond, Lauren, but the other issue being as well that, yes, you're right, there is some evidence to say that masks aren't effective, but there's also counter evidence, WHO changing their evidence on that one, their stance on that. Many other medical professionals have the stance that masks are effective. So therefore, we're sort of in this limbo of getting conflicting advice.
We are, but why is the government not putting that evidence before us? Because they're not. And as far as the WHO is concerned, they change their narrative to fit what the governments are doing daily. So they changed the definition last year of herd immunity. They changed it to include just vaccines instead of vaccines and natural infection, and both contribute to herd immunity. So I can't actually take the WHO seriously when they change their definitions and their stance. But there's much more.
All right, well, let me just let Lauren get in now, because Lauren, we've heard a lot there about the anxiety people feel. I mean, you are someone who is an expert on fear and phobias and stress as well. It does increase whether we like it or not. Some people find it difficult to see people in masks. They find it difficult to wear them. It does make them more anxious with people wearing them. So surely you should be someone who's in favour of getting rid of them.
No, I'm not in favor of getting rid of them. I think any fear can be dealt with. So, and there are exceptions. Of course, if you're claustrophobic, you're not going to be liking wearing a mask, and there are exceptions. But in majority, I think wearing a mask does make a difference. I have lost my father and I've lost my cousin from COVID. And I do respect that. I think wearing a mask is still helpful. If we are looking at always in the evidence, I think we should look more at the common sense and be more careful. And of course, if you have chaos and if you change the rules and if you keep saying you can do this or you can do that, there's going to be, the minute there's no clarity, people are going to feel vulnerable and going to fear. So people have got used to wearing a mask. People know when they're walking into a restaurant, when they're walking into a shop, they're going to put their mask on. My daughter is in school, she wears a mask. People are educated, they know how to wear the mask. It's part of their life now. It's not a big deal anymore. They go to school, they leave the house, they have
but
a mask
Lauren, respectfully, I mean, you say people are educated, they know how to wear them. I mean, I think Renee had a very good point there when she says that, and I've done it, and I'm not perfect. Look, if I reach into my pocket now, I've got a screwed up mask in my pocket that will probably be the thing that I grab if I get on the bus, when I get on the bus home later, which isn't probably the most effective way to look after my mask.
No, fine, but you're still protecting at least. Look, I do believe, and this is my, I'm not telling people what to do, but I do think that the government has decided that we should wear masks. We live in this country, we follow the rules, and that's what it is. And then if they change the rules, then it's going to be down to what the person wants, and if they feel comfortable not wearing the mask. People wear masks because they feel that they're protecting either the other person or they're protecting themselves. The mask was introduced for a reason in the first place, okay? I personally will carry on wearing the mask at the moment because we are in a pandemic. I don't need any evidence to decide what I feel is right for me, but I definitely would not do it out of fear. I would just do it because I feel it's the right thing to do at the moment while we're in a pandemic.
I mean, isn't that part of it, Dr. Rennie, that it's actually just kind and reassuring? I take what you're saying, that some people don't feel happy or reassured by it, but some people do. Some people who work in shops, some people who work in a public-facing job, they feel more reassured if the people in front of them have a mask on. And isn't that kindness an aspect of this?
So this may be kindness, but I think we have to be kind to everybody. And I think, as I was going on to say, I'm seeing damage right from birth up to teenage years. So when I do 8-week baby checks, which we all do, obviously every baby has an 8-week baby check, one of the signs of a baby developing properly is that it smiles. I cannot get a baby to smile until I take my mask off, because babies respond to the faces that they're seeing, and every time they do, they build a neural pathway that sets them up for their brain development and emotional development in the future.
But babies can encounter people who are not in masks at home. It's not like babies are never
only
seeing anyone.
But they need to see strangers too, Krista, and they need to learn how to deal with them. Children, toddlers are not seeing faces. None of this is normal, and we shouldn't make it normal. Teenagers who are absolutely
the pandemic is not normal.
Okay, go on, Rennie, you finish.
Teenagers that rely at this very delicate age of their life where they're learning to interact, build relationships, read facial expression, can't do that. And deaf people can't hear people speak anymore because they can't read lips. And that's really traumatic.
All right, listen.
We are doing damage.
Lauren, I'm going to come back to you and let you respond.
Look, a pandemic is not going to go forever. At the moment, when you're in a pandemic, you need to adapt. There are changes. You can't just cuddle whoever you want. So it's all about adapting. And I'm actually a sign language, qualified in sign language and in lip reading. So I totally understand how difficult it is if you're wearing a mask. You can wear a mask that actually you can see the lips, okay? So there's always a way of adapting. A pandemic, the main thing is to be flexible, to adapt yourself and not to live in fear. But if you're still wearing a mask on an aeroplane, or if you're still going to compulsory, there is a reason for it.
But if that's driving that fear, though, I mean, surely you get the point, Lauren, that as someone who's an expert on fear, your argument is that, look, by having masks, we won't be living in fear. But, Dr. Renee is making the point that you're perpetuating that fear by having those masks.
You're not perpetuating the fear. The most important thing, you're not at all. By analysing so much, we're putting the fear in the children. Children are so easy to adapt. It's not a big deal at the moment. I mean, they wear masks because they adapt. And the minute that they don't need to wear it, they won't wear it.
Dr. Renee?
It's important not to put fear in people, okay? But
I mean, are we doing that, Dr. Rennie, by having this conversation, by debating it, by having these rules not being clear? Is that the thing that's putting fear in people?
Right, so two things. Firstly, if masks were working so well, we wouldn't have rising cases now because everybody has been wearing them.
Well, but so secondly, vaccine is supposed to work. The vaccine is supposed to work. That's sorry.
Okay, let her finish.
So, secondly, there is Very good evidence. And Laura Dodsworth has actually spoken to people from SAGE and SPI-B who actually have said very clearly, anonymously, that masks were introduced to actually convince people that everything was very dangerous and to signal fear, because fear is the way that they get people to comply with rules. When we have fear running around in our bodies, we have cortisol, which is damaging to health. And I am seeing children, and I'm the parent of a 3-year-old, nearly 3 next month, and I know what's going on with these children because they come to me as their GP to express their fear. And I understand what Lauren says about she might be able to work with people to help them through. But I don't know if you know what the wait lists are to get somebody to see a mental health counsellor in the NHS, Lauren. It is months and months.
But Renee, I think, you know, a lot of people would agree with what you're saying in as much as the fear that is being driven by people wearing masks. But where I think that it might be a bigger stretch to get to is this idea that it's all part of a plan to make us scared. Because if that were the case, why have surgeons been covering their faces for years? Why are there many medical situations where, when appropriately worn, masks have been used in order to stop people being able to pass germs on? So surely there is some data behind it that is beyond people just wanting to scare others.
When I started this conversation, Christo, I said in a clinical setting. We know in a clinical setting. So my partner is a surgeon. So I know very well how these are worn. And they don't touch them once they are on their face, ever. It goes on their face and their mask never gets touched again until it comes off. Okay, so that's number one. And number two, there is evidence from SAGE minutes that they tried to ramp up the fear to make people comply. And in interviews with them, they have said that that's what masks are about. They're a signal. They're a collective signal to everybody that this is very dangerous. And obviously, I'm really sorry, Lauren, about your uncle and your dad. Of course I am. That's tragic. And I wouldn't want that to happen to anyone. And if I truly believed that masks would have prevented that from happening, I would have supported them.
I mean, I'm pretty sure it does make a difference, and it can protect. It would protect. But I don't think that if we explain to people that if we don't put fear in people, wearing a mask is not such a big deal. If there is a chance of saving somebody's life, then it's not such a big thing. We know we're not going to live forever wearing a mask, okay? The pandemic is going to go at some point. So I think it's learning how to be resilient, and it's learning how to adapt in the pandemic. All this is new. No one knew how to live in a pandemic.
Lauren, isn't it a fair point that Dr. Renee makes that, well, look, if masks were so effective, surely the transmission rates we would never have needed so many lockdowns. We would never have needed to have had so many people, yourself included, to have been in the most awful situation where they've had to lose relatives because the mask would have been really effective at preventing a lot of that happening.
We don't know how effective it will be, but all you know is that it's true. If when you speak, you do project. And if COVID positive, there's more chance that you're going to catch it from someone else. But the government did make a rule of wearing the mask. They didn't make that rule for no reason. They're still keeping their rules for indoors and on the plane.
But initially, Lauren, they didn't have that rule. I mean, when there was a shortage of masks, the more cynical among us would say, well, hang on, it was very convenient that when there was a shortage of masks, the rules were you didn't need a mask. And then as soon as the masks became available, we all needed them.
Look, the most important thing is not to put chaos. The more clarity people have, the more clarity the message is, the less people are going to be in fear. And yes, there's a waiting list. I offer free consultation, so anyone can come to me and clear their fear. I help people without even charging, okay? So there is always a way to adapt. And
so let her finish, Renee, let her finish, then I'll give you the final word.
The government is giving you the choice now. So I would respect somebody who doesn't wear a mask, and I would respect the person who wears a mask. Now they're giving you the choice to make your decision and how you feel, and of course we can't stop that children have been affected by it, but it's not just the mask. What's more important is the online schooling, how it's affecting them. That has put a lot of anxiety.
Right.
The mask is a minimum.
All right, Lauren, let me just give you the final word, Dr. Renee. How would you respond to that? How would you respond to Lauren's point as well that, just factually, when I'm talking now, liquid spit might come out of my mouth. I will breathe fumes out when I've got a mask on. It is naturally, just by common sense, that will be reduced somewhat.
Okay, so common sense isn't what we should be dealing with here anyway. We should be dealing with evidence, and the government have yet to put any evidence before us. And I think it's really important what Lauren says, that it should be a choice. And I agree with that. And I would absolutely respect anybody who wants to wear a mask, and I wouldn't ridicule them, and I wouldn't look at them oddly. And that should be returned. And I'm aware of somebody who got attacked yesterday on the street for not wearing a mask. So that needs to go both ways. And in terms of our children, yes, of course, the whole schooling thing and everything else has really caused them anxiety, but so has wrapping up their faces, telling them that they might go home and kill granny. That's why they have to wear a mask. And I'm sorry, we must not do this to our children. And we need to be sensible. If we've got symptoms of COVID, if we've got symptoms of a cold or flu, we should stay home. We shouldn't be out there relying on a mask to stop us passing it around.
All right, Dr Renee Hoenderkamp and Lauren Rosenberg as well. Thank you for taking the time, the two of you, to debate this tonight here on Talk Radio. So where do you stand? You've heard two very compelling arguments